My name's Deanne Lazovich. I'm an associate professor in the School of Public Health and the Masonic Cancer Center. Well, the take-home message from our study is that indoor tanning is not safe. We interviewed over 1,100 persons diagnosed with melanoma and over 1,100 persons who did not have melanoma, and examined indoor tanning use in those two groups. And among those who had tanned indoors, we found that the risk of melanoma was increased by about 75% compared to those who had not tanned indoors. We also found that the more tanning that took place, the greater the risk of melanoma. The indoor tanning industry promotes the idea that exposure to ultraviolet radiation in a controlled environment in moderate amounts is perhaps a better way to get a tan than going out in the sun. But our results would suggest that it doesn't matter whether ultraviolet radiation comes from the sun or whether it comes from artificial devices like indoor tanning, that the risk is still the same for developing melanoma. From my standpoint, the two public health messages are this. First, that ultraviolet radiation exposure should be avoided, whether it comes from indoor tanning or whether it comes from the sun. And second, I think that indoor tanning use is an underappreciated risk factor for melanoma. When we look at national data, we see that the proportion of women who report tanning indoors is actually higher than the proportion of women who report current smoking. And so I think that we really need to pay more attention to indoor tanning as a harmful practice that affects the health of our population, especially young women.